Healthcare is a highly debated topic in today's society. There are approximately 323 million people in the United States, and in the few years leading up to the passing of the Affordable Care Act, 79 million Americans lacked adequate health insurance or health insurance in its entirety. Many do not quite understand the Affordable Care Act and its impact.
A common myth about healthcare reform is that it began with the Affordable Care Act. Facts. Healthcare reform has been proposed many times in the past. In 1965, Lyndon B. Johnson proposed Medicare, which would provide health insurance for seniors, as well as Medicaid for poor individuals. Lawmakers proposed 3 universal health care plans in 1970. In 1975, President Ford expressed his reluctance to supporting any sort of health care reform plan that was proposed. The health care reform plan proposed under President Bill Clinton was not well supported. It was an attempt at universal health care that was unsuccessful. This plan highlighted the difficulties that comprehensive health care reform presents.
Myth: the Affordable Care Act is one step closer to socialized medicine. Fact: the Affordable Care Act does not socialize the healthcare industry in America. It seeks to regulate and expand the existing private insurance market so that it provides near universal coverage to Americans. Included in the bill are the individual mandate and the expansion of state Medicaid programs, tools that are meant to enable Americans who can afford it to purchase private insurance and provide safety net coverage for those who can't. The exchanges established under the Act don't even include a public option for health insurance, so the government is not competing with private insurers in the market, the opposite of a socialized system. Let's get our facts straight.
People commonly think that NFIB v. Sebelius resulted in a win for the Affordable Care Act in its entirety. In fact, the ACA was not struck down by the court in NFIB v. Sebelius, but one important part of the law was declared unconstitutional. Medicaid expansions, which forced states to provide coverage to families and individuals with an income of up to 138% of the federal poverty line, was interpreted to be unconstitutional coercion on the part of the federal government and a breach of proper federal power. Instead of upholding the expansion, the court ruled that states could opt in to the law's new coverage guidelines for Medicaid, but they did not have to. Some states' Medicaid programs already met the requirement, and some states chose to opt into the Medicaid mandate because the federal government was footing over 90% of the bill. Some states with low Medicaid thresholds like Texas, Florida, and Virginia, however, have continued to resist opting into Medicaid expansion.
Myth: the Supreme Court ruling that the Medicaid expansion was unconstitutional on the grounds of being coercive to states was objective and unique. Fact: this is actually the system used to enforce several pieces of key U.S. legislation. For example, the drinking age, the national highway system, and the state standardized testing regime. All coercive based on Sebelius. So, if you don't feel like waiting till you're 21 to drink, walk down to the Supreme Court one of these days, tell them how you really feel about state coercion.
Myth: when the Supreme Court ruled that states could opt out of Medicaid expansion, it did little to change the overall effect of the bill. Fact: when the Supreme Court ruled that states could opt out of Medicaid expansion, it created the Medicaid gap, thereby leaving a portion of the population uninsured. The Affordable Care Act was envisioned as the vehicle for extending Medicaid insurance coverage to all low-income individuals. However, the June 2012 Supreme Court ruling essentially made the Medicaid expansion optional for states, and to date, 19 states have opted out of expansion, effectively leaving many individuals without coverage. Because the Affordable Care Act envisioned low-income individuals receiving coverage through Medicaid, it does not provide financial assistance to people below the poverty line for other coverage options. As a result, in states that do not expand Medicaid, many adults fall into a coverage gap of having incomes above Medicaid eligibility limits, but below the lower limit for marketplace premium tax credits.
There are many misconceptions surrounding the aftermath of Obamacare. One myth is that the Affordable Care Act was a complete failure. Well, this isn't true for several reasons. There are now more than 12 million Americans that have received coverage through the ACA. Uninsurance rates have dropped, and the rise in premium prices have slowed. However, even with all this, many would argue that there are still many areas of the law that need to be revised. Here's another myth. The Affordable Care Act's successes and the need for overall health reform in America. Well, what is still unknown to many is that the United States still spends 17% of its GDP on healthcare, and the Medicaid gap still leaves thousands of Americans without access to health insurance. While the Affordable Care Act has its pros and cons, the laws will not solve the long-term healthcare challenges that America currently faces, and it really only serves as a temporary solution.